Hi, my name is Arshad Khanani. I'm with CRI Associates. Here at AAO in San Francisco, I presented the phase 1 data of THR-149. This was an open-label dose escalation study in patients with previously treated for diabetic macular edema. THR-149 is a novel molecule because it targets plasma kallikrein in patients with DME. We know that up to 40% of patients with DME don't adequately respond to anti-VEGF treatment in terms of BCVA and CST improvements. Targeting pKal offers a VEGF-independent mechanism for inhibiting DME, and preclinical studies have shown elevated levels of pKal in these patients. THR-149 was a phase 1 study looking at safety of these molecules in patients with DME. The primary endpoint was incidence of DLTs up to and including the day 14 visit. They were defined as intraocular inflammation, 2 plus or more in any of these patients. We also look for BCVA greater than or equal to 10 letters of ETDRS letter score decrease from baseline. If you look at this study, there was a dose escalation study looking at 3 doses of THR-149, 0.005 milligram, 0.021 milligram, and 0.125 milligram. The first cohort had 3 patients, the second cohort had 3 patients, and then the high dose had 6 patients. These patients were followed, and we looked for BCVA, SDOCT, fundus photography, and fluorescein angiography on top of safety. If you look at these baseline characteristics, 12 subjects received study treatment. All subjects completed the study. All subjects attended all study visits. In terms of baseline characteristics, 50% male, 50% female, 92% white, and the mean age was 68.7. If you look at the visual acuity, you can see that the baseline visual acuity in each group, as well as CST. One point I want to make is these patients were heavily pre-treated before they got into the study. In terms of safety of THR-149, there were no DLTs, which is a good news for a safety study. There were 3 non-ocular, non-treatment related SAEs reported in 1 subject. 1 subject had a visual acuity loss of 6 letters in the middle dose group at 1 month. 1 ocular AE was attributed to study treatment, likely injection procedure with the middle dose. All ocular AEs were likely due to the injection procedure or underlying progression of disease or concomitant disease and not THR-149. Efficacy of THR-149 here is shown in mean change in BCVA from baseline. One thing to note that mean BCVA gain was fast and it was maintained until end of the study. Here you can see that patients with single injection by day 14, they had 7.5 letter gain in this visual acuity. And one thing again to keep in mind that these were previously treated patients with DME. If you look at the mean change in CST, marginal impact on CST was noted at day 1, followed by increase until study end. Mean CST change was minimal and within the variability of measurements. We also looked at the link between baseline characteristics and BCVA response. This was an exploratory analysis, and it was showed that baseline BCVA, macular volume, and Eyerson's DR are more predictive than baseline CST or pKal levels for BCVA response. Better BCVA, lower macular volume, and longer duration of DR was indicative for BCVA response in these patients. If you look at the macular volume over time by subjects by BCVA, you see that in the BCVA responders, macular volume was maintained over time. In conclusion, in this safety phase 1 study, single injection of THR-149 was safe and well tolerated. No DLTs were reported. There were no ocular SAEs. 1 treatment-related ocular AE occurred that was considered related to the procedure itself and resolved within a few days. All other ocular events were mild to moderate and unrelated to study treatment. what does this mean for clinicians in practice who treat patients with anti-VEGF and they don't have a response? PCAL may offer a pathway to address in these patients to improve BCVA and visual acuity outcomes. In terms of efficacy, you saw the mean BCVA gain from baseline at all visits. It started fast at day 1 and it was reached at 7.5 letters by day 14 and was maintained at month 3 with 6.4 letters following a single dose of THR-149. The apparent disconnect between BCVA and CST was present in most subjects, and we need to analyze that. Throughout the study, 4 out of 12 received rescue therapy at or after 1 month. Macular volume at baseline seems to be indicative of BCVA response, and among the BCVA responders, macular volume was low at baseline and maintained over time. The result of these phase 1 study showed no DLTs and are encouraging, and this warrants further research with multiple injections of THR-149. A phase 2 trial has been planned and will initiate next year. Thank you.